Stress and fertility impact. The impact of stress on fertility is one topic that has gotten little or no serious attention or information. Stress impact on fertility is an overlooked topic that needs attention in today's world. I wish to say that stress is a serious contributing factor to the issues of infertility in our modern world. So much chaos in marriages and workplaces. Emotional and physical abuse induced stress is on the rise daily. When one is perpetually unhappy, it affects our overall well being, including fertility. How does stress affect getting pregnant? Stress can potentially impact fertility and the ability to get pregnant, although the specific relationship between stress and fertility is complex and not yet fully understood. Research suggests that high levels of stress can have physiological and psychological effects on the body, which may disrupt the delicate balance of hormones involved in the reproductive process. Here are some ways in which stress can affect fertility. Hormonal changes. Stress can disrupt the normal functioning of the hypothalamus, a part of the brain that plays a crucial role in regulating reproductive hormones. This can lead to irregular menstrual cycles, hormonal imbalances, and even ovulatory dysfunction, which can reduce the chances of getting pregnant. Reduced libido. Stress can lower sexual desire or libido, which can affect the frequency of intercourse and reduce the chances of conceiving. Altered sperm quality. Stress can also impact sperm quality in men. It can lead to a decrease in sperm count, motility, and morphology, making it harder to achieve conception. Disrupted fertility treatments. Stress associated with fertility treatments, such as in vitro fertilization (IVF), can have an impact on the success rates of these procedures. Studies have shown that stress during IVF cycles may reduce the chances of implantation and pregnancy. Lifestyle factors. Stress can also indirectly impact fertility through lifestyle factors. For example, stress may lead to unhealthy coping behaviors such as smoking, excessive alcohol consumption, poor diet, and lack of exercise, which can all have negative effects on fertility. It's important to note that the relationship between stress and fertility is complex and not fully understood, and not all individuals will experience the same effects. Some individuals may be more resilient to stress, while others may be more vulnerable. If you're trying to conceive and are experiencing stress, it's essential to find healthy coping mechanisms, such as exercise, mindfulness, and seeking support from loved ones or a healthcare professional, to manage stress effectively. If you're concerned about how stress may be affecting your fertility, it's best to consult with a qualified healthcare provider for personalized advice and support. How does emotional abuse affect getting pregnant? Emotional abuse can potentially impact fertility and the ability to get pregnant in several ways. The stress and trauma associated with emotional abuse can have physiological and psychological effects on the body, which may impact reproductive health. Here are some ways in which emotional abuse can affect getting pregnant. Hormonal changes. Emotional abuse can disrupt the normal functioning of the hypothalamus pituitary adrenal (HPA) axis, which is responsible for regulating hormones in the body, including those involved in the reproductive process. Chronic stress and trauma associated with emotional abuse can disrupt this hormonal balance, leading to irregular menstrual cycles, hormonal imbalances, and potentially impacting ovulation, which can reduce the chances of getting pregnant. Reduced sexual desire. Emotional abuse can lower sexual desire or libido, as it can lead to negative emotions such as fear, anxiety, depression, and low self-esteem. This can affect the frequency of intercourse and intimacy with a partner, which may reduce the chances of conception. Relationship difficulties. Emotional abuse often occurs within the context of an intimate relationship, such as with a partner or spouse. This can result in strained relationships, lack of trust, and emotional distress, which can impact the overall quality of the relationship. Relationship difficulties can contribute to stress and emotional distress, which may indirectly affect fertility. Unhealthy coping behaviors. Emotional abuse can lead to unhealthy coping behaviors such as smoking, excessive alcohol consumption, poor diet, and lack of exercise as a way to cope with the stress and emotional pain. These behaviors can have negative effects on fertility, as they can impact overall health and well being, potentially reducing the chances of getting pregnant. Psychological impact. Emotional abuse can have significant psychological impacts, such as increased risk of anxiety, depression, post traumatic stress disorder, PTSD, and other mental health issues. These psychological impacts can affect an individual's overall well being, including their fertility, as the body and mind are interconnected. It's important to note that emotional abuse is never acceptable and can have serious consequences for an individual's well being, including their ability to conceive. If you are experiencing emotional abuse, it's essential to seek support from a trusted friend, family member, or mental health professional. Taking steps to protect your mental health and well being, including seeking help to address emotional abuse, can be important for your overall reproductive health. How does physical abuse affect getting pregnant? Physical abuse, which involves any form of violence or harm inflicted upon an individual, can have significant impacts on their ability to get pregnant. Here are some ways in which physical abuse can affect fertility and the chances of getting pregnant. Physical injuries. Physical abuse can result in physical injuries, such as bruises, fractures, internal injuries, and other traumatic injuries. These injuries can potentially impact reproductive organs or disrupt the normal functioning of the reproductive system, which may affect fertility and the ability to conceive. Reproductive health complications. Physical abuse can lead to reproductive health complications, such as sexually transmitted infections, STIs, pelvic inflammatory disease, PID, and other gynecological issues. These complications can damage reproductive organs, disrupt hormonal balance, and impact fertility. Sexual dysfunction. Physical abuse, including sexual abuse or assault, can cause sexual dysfunction, including problems with arousal, desire, and sexual pain. These sexual issues can impact sexual activity and intimacy, potentially reducing the chances of conception. Psychological impact. Physical abuse can have significant psychological impacts, including post-traumatic stress disorder, PTSD, anxiety, depression, and other mental health issues. These psychological impacts can affect an individual's overall well-being, including their fertility, as the body and mind are interconnected. Unhealthy coping behaviors. Individuals who have experienced physical abuse may turn to unhealthy coping behaviors, such as smoking, excessive alcohol consumption, poor diet, and lack of exercise, as a way to cope with the physical and emotional pain. These behaviors can have negative effects on fertility, as they can impact overall health and well-being, potentially reducing the chances of getting pregnant. Relationship difficulties. Physical abuse often occurs within the context of an intimate relationship, such as with a partner or spouse. Physical abuse can result in strained relationships, lack of trust, and emotional distress, which can impact the overall quality of the relationship. Relationship difficulties can contribute to stress and emotional distress, which may indirectly affect fertility. It's important to note that physical abuse is never acceptable and can have serious consequences for an individual's well-being, including their ability to conceive. If you are experiencing physical abuse, it's crucial to seek help from appropriate authorities, such as law enforcement or healthcare professionals, and prioritize your safety and well-being. Seeking support from a trusted friend, family member, or mental health professional can also be important for your overall reproductive health. How work-induced stress affect getting pregnant? Work-induced stress can have a significant impact on fertility and may affect the ability to get pregnant. Stress is a natural response to demanding situations, including work-related stressors such as high workload, long working hours, job insecurity, lack of autonomy, and interpersonal conflicts in the workplace. When stress becomes chronic and prolonged, it can have negative effects on reproductive health, including fertility. Hormonal imbalance. Chronic stress can disrupt the balance of hormones in the body, including those that regulate the menstrual cycle and ovulation. Stress can lead to increased production of stress hormones such as cortisol, which can interfere with the normal hormonal signals needed for ovulation and fertility. Disrupted menstrual cycle. Stress can also cause irregular menstrual cycles or even amenorrhea, absence of menstrual periods, which can make it difficult to predict fertile windows and time intercourse for optimal chances of conception. Reduced sexual desire and function. Prolonged stress can decrease sexual desire and function, which can lead to decreased frequency of sexual intercourse, reducing the chances of getting pregnant. Increased risk of reproductive disorders. Stress has been linked to an increased risk of reproductive disorders such as polycystic ovary syndrome, PCOS, endometriosis, and other hormonal imbalances that can affect fertility. Lifestyle factors. Work-induced stress can also lead to unhealthy lifestyle behaviors such as poor diet, lack of exercise, and inadequate sleep, which can further affect fertility. Psychological factors. Stress can also have psychological effects such as anxiety, depression, and reduced overall well-being, which can impact fertility by affecting mood, motivation, and overall health. It's important to note that everyone responds to stress differently, and some individuals may be more resilient to its effects on fertility than others. However, chronic work-induced stress can be detrimental to reproductive health and may affect the ability to get pregnant. If you are trying to conceive and are experiencing significant work-related stress, it's important to prioritize self-care, manage stress through healthy coping mechanisms, and consider seeking support from healthcare professionals to address the impact of stress on fertility. Emotional, verbal or physical, work and other forms of abuse can cause stressful life which can affect the woman's ability to get pregnant. Stress of any form changes the dynamics of our bodies. Paying attention to stress and how to help the body adapt and respond to stress is now of great importance when looking to get pregnant. Thank you so much for listening. Please like and subscribe to our channel.